I came to Reading in 1989 and came up here because they were starting the trauma center, and that's part of my specialty. And then I was the trauma director here for many years. Orthopedics has evolved to be a biomechanical specialty where we're applying principles of biomechanics to basically help our patients. We don't rush to surgery first thing. We try other things. We try physical therapy, injections, exercise programs. Well, being a competitive swimmer through college, I love water sports. And so when this opportunity came up, I started rowing. But the nice thing about rowing, when you're in a team, it's some coordinated effort with a team of guys, which is fun. And it's aerobic conditioning. My philosophy of treating a patient is, I treat them as if they're my family. I have patients come 100 miles to see me when they have passed up many orthopedic surgeons. I say, why? You can have these other guys do it. They want to see me. I'm Dr. Daniel. I'm a Dignity Health Medical Group physician.